you. We are hearing reports from doctors who are saying they are being instructed to count deaths as coronavirus deaths, even if the person died from a different condition, but at some point in time had contact with somebody who had coronavirus. Dr. Birx just came out and said they're classifying everybody with the virus as a death instead of dying from the virus as a death. Why do you think that they are classifying this way? Why do you think there's an exaggeration in the numbers here, if you think there's an exaggeration in the death count numbers?
Look, what I do know is this, that the WHO, in conjunction with the CDC, is the one that decides what are called codes, diagnosis codes. Most people don't know, when you go into a doctor's office, a doctor looks at you, and in their IT systems, they have to say, okay, Christina has this or this. That is called a diagnosis code. That code, Christina, comes from the WHO. So for coronavirus, as I understand, they created two codes. One code was you explicitly, had a test and you had COVID-19. The other one was completely nebulous. Well, it sort of smells like that. Maybe he's got some chest pains. Something so broad, but it was still under the COVID. The doctors in the United States received a letter from the CDC, as I have found out, that went to hospital administrators encouraging them to blur both of those codes. So if someone comes in, they have a pre-existing condition, someone with a chest pain, COVID-19, okay? And in fact, when someone dies, they do the test. Sometimes the test doesn't come back for 14 days. They're still putting COVID-19 on them. So they're increasing the numerator. And then as far as the denominator goes, we don't even know how many people actually have been infected, because this is, again, a flu-type virus. So the denominator could be massive. So you have cooking of the books for two reasons. Hospital administrators get money for the COVID-19 diagnosis, plus they also get kickbacks through what are called GPOs and PBMs for the ventilators. So there's a total collusion going on, and it's not at all about people's lives. So those critically ill patients, immediately they put them on ventilators. And as I've shared in one of my videos, the ventilators actually can burst and further damage the lungs, because the real issue here is the lungs are being filled with fluid, and the fluid is occurring because of the overreactive immune system, which can really be addressed by IV vitamin C, high dosage. And that is not in the discourse. In fact, 80 to 90% of the people go on ventilators are dying. So this is essentially a death sentence that they're putting people on.
Wow, that is so interesting. Well, President Donald Trump said that the cure cannot be worse than the problem, and yet here we are. We continue to be on lockdown status. Do you think the economy should have been closed in the first place? And is this the new status quo anytime we see a new virus?
It's a great question. In my letter to the president, which I sent on March 23rd, I said, look, we live in the era of personalized and precision medicine, which is an expertise of mine, which I get invited all over the world to talk about. What that means is one size does not fit all. You don't lock down everyone. That's what Fauci's model is. It's a medieval model of medicine. And so what we fundamentally have is the approach that we should be taking is taking the people who are truly immunocompromised, truly have COVID-19, fine, they should be isolated, boosted up with immunosupporting things like vitamin A, D, and C. Those of us who are well, we should be back to work. We should be running this economy. Okay, if you want to take something to support your immune system, do that, which should be the vitamin A, the D, etc. One of the two most disastrous things here are we're socially distancing people and hiding them. Go look at the research, a landmark study. When you isolate people, that is one of worse than the detriments from obesity, smoking, and heart disease. Social isolation actually leads to upregulation of inflammatory compounds in the body and downregulation of antiviral compounds. So you're basically increasing the person for viral infection by the amount of stress you're causing them from social isolation. And separate from that, we're telling people not to go out in the sun, which is vitamin D. Vitamin D is an antimicrobial. So this is essentially a recipe for actually hurting people, not really supporting them, but all brought to you under the rubric, and media says it over and over again, social distancing, flatten the curve. And this is sort of the nonsensical science that Fauci is expounding, and it's what needs to be exposed, and really what we really need to talk about if we truly care about public health is building up people's immune system. But that's not what Fauci and company are concerned about. Their model is big ag, which dirty air, dirty water, dirty food. They want people to consume not food that's healthy for them. And then the solution is vaccine mandates. Think about what's going to happen a year from now. When you go to get your driver's license, Christina, where's your vaccine card? And Fauci's already talking about that.
Yes.
Can you go to a
Oh,
gym?
yes, he
This
is.
is about developing a police state. I hate to use these very
Yes.
harsh terms, but that is what we're talking about, control of the individual. It's a very, very dangerous time, but it's also an opportunity for Americans to go back to our roots, which is freedom, which is basically listening to truth and basically starting to, take back what is really ours, which is our truth, freedom, and health. And Fauci's not about that. He serves the masters of Bill Gates, the Chan Zuckerbergs, the Clintons, the CDC, the WHO, and in fact, the Chinese. This is what we're seeing before in front of our eyes is exporting Chinese model of governance, top down, controlling the last oasis of freedom, which is our human body.